Well, believe it or not, the analyst feels. We sit in the clinic, he or she usually stares at us quite blankly, but they feel, they have feelings. And the question is what to do with these feelings. Right? And the question of countertransference is exactly this question. How does the analyst, or should the analyst, use their feelings in order to direct the analysis? Now, today I would want to present maybe a controversial answer, and that is a distinct and clear no. This answer is propagated by one of the most famous French psychoanalysts from the 20th century called Jacques Lacan. Now, let's start commonsensically. Why shouldn't the analyst use feelings in order to direct the analysis? Start with just a silly example. Let's say an analyst has a very, very strong aversion from people with blue eyes and large nostrils. Something unconscious, I don't know, some childhood trauma that has not been treated, let's say. And let's say this analyst receives a patient with, I don't know, brown eyes and small nostrils, but then receives a patient with blue eyes and large nostrils. And the analyst feels something is wrong, something does not feel right? By, let's say, communicating this feeling to the patient, in a way the analyst is communicating something about him or herself, which probably does not have a lot to do with whatever is recounted by the patient in the clinic at that point. Second point, the otherness of the patient. We grow up in quite a narcissistic way, feeling that other people are like us. And that's true to a certain extent. We can relate to people, we can empathize with people, we can understand, try to understand how they feel and help them feel better. You meet someone and you listen to their story and you try to put yourself in their shoes and say, if I was in his shoes, I would have felt this way, and maybe give him some input on that. That's something that goes on with friends, right? But in the clinic, you very quickly find out that people are very much different, in a sense that you can't really even imagine why they fantasize, wish, hate, these things that they recount in the clinic. They are so different that you just find it very, very hard to empathize with that. Now that can happen even on a level where you are dealing with a subject of the same structure as yourself, let's say, an erotic and a neurotic. But when it comes to a perverse subject or a psychotic subject, this difference can be so radical that by attempting to empathize and understand the other patient and then working with your feelings in order to progress the analysis could really cause huge, huge problems. Now, number 3, has to do with training analysts. Now, if we believe or if we think that this inner aptitude to understand, this empathic inner quality is the most important aspect of psychoanalysis, and let's say an approach that is valid, we can say that is the case, then when we talk about training analysts, we're actually talking more about a screening process. We're looking with people that have this natural ability. Some people are better in empathizing. Some people have stronger empathy, stronger intuition. And in this sense, training analysts would have to do with, with the metapsychology and the practicalities. But eventually we're saying that some people should be analysts and some people should not. This is already an ethical standpoint, and it has its own problems. So this is just generally speaking. Now, Lacan does not say that the analyst does not feel or should not feel. Of course we feel, right? What Lacan is saying is that these feelings, which we will call today countertransference, are not to be a tool that is used to direct the analysis. Okay, so it's not saying that there's something wrong about it. It's just saying, this is not a very useful tool in directing the analysis. Now, Lacan proposes 2 axes with which we can describe the analytic situation. Right? The first one is called the imaginary axis, and the second is called the symbolic axis. This is due to his distinction between the imaginary, symbolic, and real registers that we will not get into today, although it's a hot topic. But I mean, this distinction is used in order to understand the analytical situation in psychoanalysis, so we will stay with the imaginary and the symbolic today. Now, the imaginary axis is exactly this relationship between one ego and another ego. This is the axis of identification, of empathy, of understanding. I imagine what it is like to be you, and then I put myself in your shoes, and through my education, through the years the place that I grew up, the ideas that I absorbed, I get a feeling or an idea of who you are, and then I tell you, well, that's what you feel right now, or I understand you at this point. Right. So this axis, the axis of understanding, of empathy, according to Lacan, is not a very useful tool in psychoanalysis. For the reasons that I gave just before, and for many more. Eventually, Lacan says that on this axis, we mostly see a competition for love and recognition. And you see the analyst asking, well, why did he say that? What did he want from me? Does he love me? Maybe next time I'll start by talking about a book that he likes. Oh, I saw this book on the shelf. Maybe he doesn't like people like that. All these questions about the person of the analyst are a crucial aspect of the beginning of analysis, but what we try and do in Lacanian analysis is to set them aside and clear the way for the symbolic axis. Now, in the symbolic axis, the analyst is not situated in the place of a person, of his person, of who he is or she. Yeah? He is situated in the place of what Lacan calls the big other. Now, this is a huge term, but let's just simply say he is situated in the place where language is, where the language of the analyst is, where the language of the analysand is, where the signifiers that appear in analysis are stored. Right? And the analyst listens not through an attempt to understand or empathize, but with a very serious emphasis on the words themselves. What is being said? What words are used and in what way? Through that, a diagnosis can be achieved and interventions and interpretations can be put in place. I'll give an example, we'll end with that. Let's give an example for an interpretation on the imaginary axis. So let's say an analysand recounts a dream about birds. And in the dream, he also talks about his brother. I don't know, this is just something I'm inventing at this point. An interpretation or an intervention on the level of the imaginary axis would have to do with what the analyst knows him or herself. Like something that has to do with their feelings or knowledge. Let's say, well, the way you recounted this bird, it's a little scary, or it feels a little awkward, or something like that. Or, you know, birds are a very small animal. Maybe you want to belittle your brother, or something like that. I'm just inventing this out of the blue. An interpretation on the level of the symbolic axis would have to do with the way language works. And the fact that a bird has been mentioned in relationship with a brother. And an interpretation on that level could be this famous idiom. The analyst saying to the analysand, well, do you know that they say that birds of feather flock together? Right? This interpretation has to sort of make the analysand think about the words that he or she used at that moment, and through that create new material for the analysis. So this would be playing with the cards open, like they say, because the analysand doesn't hide anything about the place from where the interpretation has come. With this interpretation, all the cards were on the table. This idiom exists in language, the analysand and the analyst know it, and there is no intervention of a very personal aspect of the analyst. So very briefly, this is the difference between these two kinds of interventions, and why the second one is based on the assumption that countertransference shouldn't be used as a tool in analysis.